Do you understand the difference between sildenafil and tadalafil, also known as Viagra and Cialis? That's exactly what we're going to cover today. I'm Dr. Rena, a urologist and pelvic surgeon, and on this channel we discuss sexual health, bladder wellness, and a whole lot more. If you enjoy this kind of content, don't forget to subscribe and share it with others who might benefit. Before we dive into how these medications help with erectile dysfunction, it's important to first understand how an erection actually occurs. The first step is arousal. You might see, hear, smell, or feel something that stimulates you. This triggers your body to release a substance called nitric oxide, which acts like a spark that starts the erection process. So, for an erection to happen, you need both arousal and nitric oxide. Once nitric oxide is released along with arousal, your body begins producing several chemical messengers. One of the key ones is called cGMP, or cyclic guanosine monophosphate. As these messengers increase, the smooth muscles in the penis begin to relax. This relaxation allows blood to flow into the penis, while at the same time the veins narrow to keep the blood from flowing back out. The result is a firm erection. So what causes an erection to go away? There are three main factors. First, the nitric oxide, or the trigger for arousal, fades away. Second, the chemical messenger cGMP begins to break down or decrease. And third, your body has a natural nerve response to ejaculation. When ejaculation occurs, your nervous system becomes more active, causing those smooth muscles to tighten. This pushes blood out of the penis and back into the rest of the body, which leads to the penis becoming soft again. All of these medications used for erectile dysfunction work by slowing down the breakdown of that chemical messenger, cGMP. They do this by blocking an enzyme known as phosphodiesterase. Now, before I explain the differences between sildenafil and tadalafil, also known as Viagra and Cialis, it's important to understand that these medications share some common side effects. These can include headaches, facial flushing, nasal congestion, heartburn, and occasionally changes in vision. There is also one type of medication that must never be taken together with these drugs, and that is any medication containing nitrates. A common example is nitroglycerin, which is often prescribed for individuals who experience chest pain, medically referred to as angina. This is typically given as a tablet that you place under your tongue if you have chest pain that doesn't go away. So, if you are taking that type of medication, you should not use any of these treatments for erectile dysfunction. The reason is that combining them can cause your blood pressure to drop to dangerously low levels, which can even become life-threatening. In addition, there are certain medications that can interact with these drugs. If you have kidney or liver conditions, your dosage may also need to be adjusted. That's why it's very important to use these medications under the supervision of a doctor. You might come across some over-the-counter supplements that are not supposed to contain these ingredients, but actually do. Those can be risky because you could end up taking too much or too little without realizing it. There are also a couple of very rare but serious side effects linked to these medications. One of them is called priapism, which is an erection lasting longer than 4 hours. This is not a good situation because a prolonged erection can start damaging the tissues in the penis and may lead to permanent harm if not treated quickly. Thankfully, this is extremely rare, especially when the medication is used correctly. It's usually seen only in cases where someone has taken an excessive amount. Another uncommon but potentially serious side effect is hearing loss. I personally have never encountered that in my career, but it has been reported as a very rare yet serious side effect. When it comes to effectiveness, both of these medications have a success rate of about 60 to 80%. So if you're comparing how well they work, they are fairly similar. Now, why am I focusing specifically on Viagra and Cialis, or sildenafil and tadalafil? The reason is that, at least in the United States, these tend to be the most affordable options for treating erectile dysfunction. And since they are equally effective, these are the ones I most commonly prescribe. Looking at sildenafil in particular, its origin story is actually quite fascinating. It was initially developed as a treatment for high blood pressure. During clinical trials, researchers were testing whether it could help lower blood pressure. What they discovered instead was that it didn't significantly affect blood pressure, but participants began reporting stronger and firmer erections. And that unexpected finding is what led to the creation of Viagra. Sildenafil is the oldest medication available for erectile dysfunction, which means it has the longest track record in terms of research, effectiveness, and safety. When taking Viagra, it's recommended to use it about 30 minutes to an hour before sexual activity, and ideally on an empty stomach. Eating a heavy or high-fat meal beforehand can reduce how well the medication works, so it's best taken either on an empty stomach or after a very light meal. The medication stays active in your bloodstream for about 4 hours. It comes in different doses, starting at 25 milligrams and going up to 100 milligrams. It is only available as what we call on-demand dosing, meaning you take it shortly before planned sexual activity rather than on a daily basis. You can't take it as a daily medication every single day. It doesn't work that way. One of the side effects that is more specific to Viagra is something called blue-green color changes or altered color vision. If that happens, you should stop taking the medication right away and speak with your doctor. Another side effect that can occur with Viagra, but is not typically seen with Tadalafil, is nosebleeds, although this only affects a small number of people. Tadalafil is a more selective phosphodiesterase inhibitor, which means it more precisely targets the enzymes involved in creating erections. It was introduced in 2003, so we don't have quite as much long-term data on Tadalafil as we do with Sildenafil. Like Sildenafil, it should be taken about 30 minutes to an hour before sexual activity, and it can also be taken on an empty stomach. One key difference is that Tadalafil stays in your system much longer, up to 36 hours. So, if you're planning for more than one intimate moment over a day or a weekend, this can be a very convenient option. It also comes in a low-dose version that can be taken daily. Some people prefer this because it allows for more spontaneity, since you're taking one pill each day and don't have to plan ahead. The on-demand dose typically ranges from 5 milligrams to 20 milligrams. You might notice that this is lower than sildenafil dosing, but that doesn't mean it's less effective. It's simply a different medication. Another benefit of low-dose daily Tadalafil is that it can also help men who have benign prostatic hyperplasia, or BPH. What it does is help men who are dealing with urinary symptoms related to BPH. Things like trouble fully emptying the bladder, straining when urinating, waking up during the night to go, feeling a sudden urgency, or needing to urinate more frequently. So if you're experiencing both urinary symptoms from BPH and erectile dysfunction, you may be able to manage both issues with just one medication. There's also some evidence suggesting that men with complete erectile dysfunction, meaning no erections at all, may respond better to Tadalafil compared to other options. So, which one is the better choice for you? Let me share some data comparing Sildenafil and Tadalafil directly. I looked at a meta-analysis. And if you're new here, I'm a big fan of meta-analyses. These are studies that review all the available research on a specific topic and analyze it in a structured way. They combine results from multiple studies, making the conclusions more reliable than any single study on its own. This particular meta-analysis and systematic review compared Sildenafil and Tadalafil head-to-head. It included studies that directly evaluated both medications and required the use of a validated questionnaire to measure outcomes related to erectile dysfunction. They couldn't simply ask, "Did your erections improve?" Instead, they had to use a structured questionnaire that has been tested and validated to measure real, meaningful changes in erectile function with treatment. In this particular review, they included 16 studies with more than 5,000 patients. What they found was that effectiveness, as I mentioned earlier, was very similar between the two groups. But they also looked at additional factors, like how partners perceived the quality of erections, as well as patient satisfaction and how consistently people continued using the medication. Those who took Tadalafil tended to report higher self-confidence in their relationships and greater overall satisfaction with their treatment. In 9 of the studies, participants were asked which medication they preferred. In those cases, both men and their partners showed a preference for Tadalafil over Sildenafil. Overall, persistence with treatment and side effects were quite similar between the two groups. The main difference was that people taking Sildenafil were more likely to experience vision-related side effects, while those taking Tadalafil were more likely to report muscle aches. So, what do I usually recommend? If you have urinary symptoms related to BPH, then a daily low dose of Tadalafil can be a good option, since it can address both concerns. If you're open to using medication only when needed, you can try either one, and if one doesn't work well for you, you can switch to the other. Just make sure you're doing this under the guidance of a physician. There are also several other treatment options for erectile dysfunction beyond medications. These include urethral suppositories, injections directly into the penis, vacuum erection devices, and even penile implants. If you'd like to learn more about those, feel free to comment below and I can cover them in future videos. And as always, remember to take care of yourself, because you deserve it.